Welcome to this Postural Care Training video, produced by Lincolnshire Community Health Services NHS Trust. My name is Abigail Storn, I'm one of the Specialist Children's Occupational Therapists.
And my name is Katie Clements and I'm one of the Specialist Children's Physiotherapists. As a team, we're really passionate about helping you to protect your child's body shape and are committed to working with you to achieve a workable 24-hour postural management plan. The aim of this video is to really help you understand why postural management is important, as well as highlighting the potential health complications that may arise with your child if their body shape is not protected.
Postural management is the term used to describe the 24-hour physical management of a child who has a physical disability and limited independent movement. It's therefore all about protecting your child's body shape. Children who find it difficult to move, for example those with multiple disabilities, are most at risk of developing body shape distortions. This is because they sit and lie in limited positions and lack the ability to move freely and achieve a straight position. If we can help you learn to understand why certain postures are distorting your child's body, we can support you to correct them. Postural care is about using the right equipment and positioning techniques throughout the day and night to help to protect your child's body shape. The earlier the intervention, the better, but it's never too late to start. Failure to protect your child's body shape can result in lots of health complications, such as stiffness of the knee and hip joints due to muscles becoming tight, also known as contractures, hip dislocations, curvature and twisting of the spine, which is called scoliosis. Spinal scoliosis can cause pressure on internal organs, and in severe cases, vital organs can become compressed, leading to difficulty breathing and repeated chest infections, poor digestion and difficulty swallowing, which may result in the child needing tube feeding, pain, constipation, skin breakdown, difficulty standing, walking and weight bearing through the legs. This can lead to reduced bone density, causing bones to be fragile and more likely to fracture. Moving and handling difficulties and problem with personal hygiene and care. Communication difficulties, poor body image and low self-esteem. Poor sleep patterns and irritability. Major invasive surgery may be necessary to try and correct or manage hip and spine deformities, which have significant high risks associated with them, with no guarantees of success. These complications cause suffering, pain, and affect your child's quality of life. They are potentially life-shortening. However, the risk of all these complications occurring is reduced considerably by the early introduction of a 24-hour postural management plan. Your child during the day already will have some forms of postural management in place, which may include activity systems, specialist seating, standing frame, specialist walker, leg gaiters, foot and hand splints. It is important to consider that on average children spend around 10 hours in bed. This is the equivalent to 42% of their total day. If we fail to support children and young people at risk of postural problems in bed, the effects of destructive lying postures can be devastating and undo all the good postural management support that you're doing with your child during the day already. Nighttime positioning is the term used to describe any action or equipment used to place our bodies in comfortable, non-damaging positions whilst in bed. Children at risk of body asymmetry will require some form of nighttime positioning to help them lie straight, but there may be different types of nighttime positioning systems available, from informal systems initially using cuddly toys or pillows to more structured specialist systems depending on the level of correction required.
What's on your shoes? Lillian was born 13 weeks early at 27 weeks. She was in hospital along with Thomas for 5 months. I was a bit concerned when she was about 9 months old because she wasn't developing like Thomas. Just things like her arm movements were slightly different. Head movements weren't correct, so I was a bit concerned. Then got referred to physio and OT. She was about 16 months when she got diagnosed with cerebral palsy. So she's got like aphatoid cerebral palsy where it affects the whole body, her arms and legs. You know, she's got very high muscle tone, fluctuating. So it's hard for her to sort of move. She can't sit by herself without being assisted and everything. So obviously it's quite a shock to me because I don't know anybody with cerebral palsy or any child like Lillian, so it's a bit of a shock. But therapists were brilliant, OT and physio. They explained everything. They explained the importance of trying to keep her joints, you know, in muscles and everything together, the importance of trying to keep her straight with the hips and the spine. So then it was just trying to make a plan of like how we're going to do that. So like we had a standing frame to begin with. Lillian was not very keen on it at all. But obviously we just built it up, got her in it, sort of stood her up for like 5 minutes. She had like a bowl so we could put balls and to try and encourage her to play. But it took time, it's not an easy task, but just slowly build it up day by day and week by week. Now she's 6 years old, she can spend up to 2 hours. And sometimes she doesn't even want to come out. She's like, you know, I ask her, do you want to come out? She's like, say, no, more. So it's surprising how much she's come along. We have a walker, that can be challenging because of her head control, but she loves being the freedom to go out and chase the other children as well as her brother. To aid with her standing frame, she's got splints, she's got pedro boots, and we have gaiters when on some days she can't keep her legs straight with a splint, so we tend to put gaiters on her as well. So she has a sleeping system where it's a bracket with her knee cosy on. That's been the hardest part of it, I think. But obviously I've noticed, I thought Lillian was very straight, and then physio and OT got the rep round, and obviously when he put her in the sleeping system, you realise how straight she was actually in the system. If she was to sleep all night in a bad position, it would undo all our hard work that we've done during the day. So obviously one was ordered for us. Lillian found it very hard, and for myself, to sort of sleep in it all night to begin with, but we've just slowly built it up. So we've persevered. It's putting Lillian in a good position and being trained how to do it. So they've come out, they've spoke to me on the phone. If I have any queries or any problems, like if Lillian's grown and it needs to be adjusted, they're on the end of the phone, they'll come out and visit and do any adjustments that we need to ensure that she has a good nighttime position. And now she sleeps on it all night to the best she can. It's perfect. Lillian has postural measurements done. It's usually on a yearly basis. If I have any concerns, the therapist will do it sooner. It's just a measurement to sort of keep my worries at bay, and it just makes sure her spine and hips are in the right position, and if any adjustments are needed, we can just adjust it. I truly believe all the postural management plan we've put in place has really helped. Lillian is a happy girl. She doesn't have any stiff joints, muscles, hips. You know, her spine is brilliant as it can be at the moment. If it wasn't for all the therapists and all the help, Lillian wouldn't be the little girl that she is today. This is the best thing for her, for any child. It's hard work. It's not easy on a day-to-day basis. Every day is a battle some days. With Lillian with her tone, you can have an easier day than another day, and with a lack of sleep it's easy to give up, but I've persevered with Lillian, and she wouldn't be where she is today without the help of all the equipment and the help I've had through the therapists.
Thank you so much for taking the time to watch this video.
We hope you found the information useful and informative. If you have any concerns, please do not hesitate to discuss them with your therapist.